All right, folks are going to start jumping in. All right, it is 1:15, and I'd like to welcome folks back for our closing keynote, which is entitled Pediatric Firearm Injuries and Fatalities, a Guide to Policies and Approaches to Firearm Harm Prevention. Just a quick reminder that if you do have questions throughout the session this afternoon, please feel free to put those into the chat. I'll be monitoring those throughout the conversation today, and we'll make sure that those are surfaced at the end of Dr. Lee's presentation. Attendees may also private chat presenters later if you would like to, so please know that that's an option. And without any further ado, I would like to introduce you all to our closing keynote speaker, Dr. Lois Lee, who is a pediatric emergency medicine physician at Boston Children's Hospital and is also an associate professor of pediatrics and emergency medicine at Harvard Medical School. At Boston Children's Hospital, she is the Associate Program Director for Public Policy at the new Sandra L. Fenwick Institute for Pediatric Health Equity and Inclusion. Dr. Lee has published seminal research on pediatric emergency medicine, health disparities, and injury prevention, including related to firearms. She is a leader in the field of child injury prevention and is chair of the American Academy of Pediatrics Council on Injury, Violence, and Poison Prevention. With her passion for improving the lives of children, she promotes child health through her clinical work, research, teaching, and advocacy. Thank you so much for being with us today, Dr. Lee, and I will turn it over to you.
Thank you for that kind introduction. And all right. So this is my only disclosure. I do receive royalties for being a co-editor of this book, Pediatric Firearm Injuries and Fatalities. So unfortunately, this is a headline I think we see all too often. Woman, unborn son identified in a fatal shooting. What's a little unusual about this story, and which is out of Norwalk, Ohio, that it was her 2-year-old son actually who pulled the trigger and killed his mother and the unborn fetus inside. And, just makes you question, why do we have firearms that actually a 2-year-old could unintentionally shoot and kill their own mother? And when we have many other things that are designed, more for safety. So obviously you're talking about firearms, and the learning objectives today are to describe the epidemiology of firearm violence. The story I just talked about is an example of unintentional. More often in the news, we're hearing about intentional firearm injuries and deaths. And I want to begin to examine some different approaches to injury prevention from firearms, and hopefully at the end of today, leave some hope that, there is actually a path forward to decreasing these injuries and deaths from firearms. And then finally, I'd like to discuss areas for advocacy related to pediatric firearm injury prevention. So this was an article we published last year called Crossing Lines. And on the x-axis, you'll see time going from the year 2000 to 2020. And on the y-axis, you'll see the fatality rate of deaths per 100,000 persons 1 to 24 years of age. And we wanted to include kids and youth up to 24 years of age, because as pediatric providers, we do take care of children through college. But you do just have to think about, when you're reading about the literature, a lot of times the age group ends at 19. And what you'll see here is that the top orange line represents motor vehicle crash deaths, and that for many years that the rates of motor vehicle crash deaths were much higher in children and youth, until 2017 when the lines crossed. And then since that time, firearms crossed over and have continued to be not just the leading cause of injury death, but the leading cause of death, more than cancer, more than influenza, more than congenital diseases of our United States youth. And again, I think we just have to think about, how have we gotten here where firearms are the leading cause of death for children and youth in the United States? But not all firearm injuries and deaths are the same. As I mentioned, I started off with a story about an unintentional shooting, but those shooting deaths are much less common. And what you'll see here are firearms divided up by the intent of injury. So again, on the x-axis, you see time, but now it starts in 2001 and extends to 2021. And again, on the y-axis, you have the fatality rate. And what you'll see here is that this top blue line represents firearm homicides. The green line represents firearm suicides, and then unintentional shooting deaths are that bottom purple line. And the lines are pretty steady, actually, for firearm homicides and suicides up until about the mid-2010s. And then you see that there has been a rise. And so for firearm homicides specifically, there's been a 79% increase since sort of the lowest rate. And for firearm suicides, we've had an even higher increase of nearly 100% increase in firearm suicides since the lowest rate. And for suicides, that was around 2007. And all in all, during this time period, we've had 157,866 firearm deaths from homicide, suicide, unintentional deaths, and other unknown or otherwise categorized means. But again, looking at the country as a whole doesn't really describe the whole picture. So here we have the 50 United States, and I don't know exactly, there's many of you from many different states. So maybe just focus on where your state is. And here, it just highlights the two leading causes of injury death, which are firearms and motor vehicle crash deaths. And what I think is striking is that the blue states represent states where firearms are the leading cause of death in that state, okay, for children and youth. And the green states are those where the leading cause of injury death is from motor vehicles. And more than 2/3 of states in our country are firearms the leading cause of injury death. The numbers on the right-hand side represent sort of the totals across the United States. So in 2021, there were over 10,000 deaths among children and youth due to firearms. And in the same year, there were 7,820 deaths due to motor vehicles. And then this looks at it by intent. And so now the colors represent something different. So the blue states are those where there are more firearm homicide deaths. And then the green states are those where there are more suicide deaths. So even though homicides result in more deaths in the United States, you can see it's nearly even among states where firearm homicide is the leading cause of firearm death versus suicide. And it's important to point that out because, again, our interventions for injury prevention are going to be very different if you're considering firearm homicide versus firearm suicide. So again, I encourage you sort of look at your state. I will point out the state of Vermont. I have a very good friend who is a pediatric intensive care unit doctor there and a firearm researcher. And she said in their state, nearly like more than 90% of the firearm deaths there are due to suicide. So now we're going to break it down just by intent. So this is a graph that was published in the technical report that our group published with the AAP in the journal Pediatrics last year. And this just looks at firearm homicide death rates by race and ethnicity, because not only do we see differences by intent, but we do see significant disparities in firearm deaths by race, ethnicity, and then I'll show you later socioeconomic status. And so this is not news. Everybody, it's well known, well documented that Black non-Hispanic children and youth have much higher firearm homicide death rates compared to other races and ethnicities. And it's really, unfortunately, Black males that are driving these numbers up. And then you'll see the next highest group are American Indian or Alaska Native non-Hispanic youth, followed by Hispanic youth. But again, those rates are, more than 4 to 5 times less than that of Black youth. However, we see a very different pattern for suicides. So this is firearm suicides. And again, we have on the x-axis, we have time going from 2010 to 2020. And on the y-axis, we have the firearm fatality rate. But it's really striking here. And again, the scale of numbers is much smaller for suicides because there are just fewer suicides than homicides. But you'll see that, consistently the highest firearm suicide rates are among American Indian and Alaska Native non-Hispanic youth. And it's been that way. And then you see actually this even sharper rise since 2019. But you can actually see that those numbers have been rising across all different races and ethnicities, which sort of makes sense if you recall the earlier slide when there was nearly 100% increase in firearm suicide deaths among U.S. children and youth over time. But disparities in firearm deaths are not only from race and ethnicity, but we certainly see it from poverty as well. So we've done a couple of studies examining the association of county level poverty on different health outcomes. So this particular paper looks specifically at pediatric suicide, and then we broke it down by different means of suicide. So this particular graph represents only firearm suicides. And we weren't looking just at the socioeconomic status of the individual, but actually of the county in which they lived. And what we found was that there was an association with increased county level poverty. So here on the x-axis, we represent county poverty concentration with increasing county level poverty across the x-axis. So on the far right-hand side, more than 20% of the population live below the federal poverty line, which is considered a very impoverished type of county. Whereas on the left side axis, the 5 to 10% of the population live below the federal poverty line. And then on the y-axis, we have the adjusted incidence rate ratio. And so basically what we found, is anything over the number 1 shows that there's an increased risk of firearm suicide. And even after we controlled for other individual and county level factors, we found that there was an increased firearm suicide mortality incidence rate with increasing county level poverty. So what that means is in counties that were more impoverished, the risk of firearm suicide increased. And we did a similar study looking at homicide. So again, across the x-axis, you have county poverty concentration with the highest county level poverty concentration on the right-hand side. And then again, the y-axis represents the adjusted incidence rate ratio. And we did a similar statistical analysis. And even after controlling for other state level and individual factors, we found that there was an association of increasing county poverty level with an increased risk for firearm suicide. But as you know, firearm deaths are literally just the tip of what we call the injury pyramid, right? So we have to think about the non-fatal injuries that get hospitalized and then the non-fatal injuries that are seen in the emergency department. And so this just represents, we have firearm deaths on the left-hand side, firearm injuries on the right-hand side. And in general, about 60% of firearm deaths, again, are due to homicide and about 37% or so due to suicide. And so it's not surprising that the vast majority of firearm injuries are actually due to an intentional assault. And from 2011 to 2020, there were 479,579 children and youth, 1 to 24 years old, who either died or had a non-fatal injury from firearms. That's nearly 500,000. That's a lot of numbers that I just threw out at you, but I'd like to break it down into something a little bit more digestible, something a little bit easier maybe for our brains to handle. But, essentially on our current trajectory, there will be over 10,000 youth, 1 to 24 years old, who will die by firearms every year in the United States. So if you think about that map that I showed you. But what does that mean? Well, that is essentially one school bus full of children every 3 days who dies. It's that many number of children who dies by firearms every day. And I like to make this analogy because, if there was a school bus of children who drove off of a cliff every 3 days, people would be up in arms. They would, put a barrier. They would maybe change the bus route. They would, do driver safety training. They would, make laws. They would make regulations. There would be all these changes made just to prevent that bus, right, from going off the cliff every 3 days. We essentially are seeing the same thing, but it is not a bus. It is a firearm. And so again, we're actually seeing almost in some states worse than nothing being done, but other states are trying really hard, right, to try to stop that bus from falling off that cliff. So how did we get here in the United States? Well, according to the last census, there were about 330 million people in the United States. So I just want you, I'm going to pause here for a second. I want everybody to think for a moment, how many guns do we have in the United States? Do you think it's more than 330 million? Is it less? Is it the same? All right, I hope you have that number in your head. Well, the truth is we don't really know. So it's somewhere probably between 400, maybe 500 million guns, but no one really knows, right? So unlike your motor vehicle, where when you buy a car, right, you have to have a license, you have to have insurance, you have to have driver's ed training, and you have to have it registered. You're registered with a license as well, right? Before you can even drive a car, you have to have all these things. You have a license plate so that the police can track you. And so we know exactly how many cars there are in the United States, and we know a lot about the people who drive them and about their insurance, and if they're a good driver, if they're a bad driver. Well, we don't have any national information about firearms. Some states you are required to, have a license and get it registered, but many states you're not. So we don't really, and those are the legal guns, right? And as we know, there's illegal guns that get trafficked, and now ghost guns where people can literally just print gun parts with a 3D printer and put it together. So kind of scary to think all that we don't know about how many guns are in the United States. But because we have so many guns, not surprising, we have a lot of gun violence. So how does this affect children? Well, this was an interesting study done by one of my friends and colleagues, Dr. Matt Miller, and they basically did a survey, a nationally representative survey of households, of firearm owning households who have children in the home. And what they found was that about 15% of these households store their firearms loaded and unlocked, which is what we consider probably the most unsafe way to store a firearm in your home. And then another 44% stored them unloaded and locked away. But what that essentially means is that 40% of households with children have one or more firearm, and that accounts for about 30 million children. And of these households, about 4.6 million children live in households where firearms are loaded and unlocked. So, they have easy access to loaded firearms, which again is something that you have to think about when you have a curious 2-year-old, right? Or you have an impulsive, possibly suicidal or homicidal teenager. When they have easy access to guns, that is potentially a recipe for disaster. So now we've talked a little bit about the epidemiology of firearm violence. We're going to switch gears a little bit to examine some different approaches to injury prevention from firearms. So this is a similar map to the first crossing lines one, but I'm backing it up to 1990, right? And here you see that the rates of the motor vehicle crash deaths are even higher. And so, rates started off very high and have persistently been higher than firearm deaths. But what happened in these intervening decades? Really, since the 1970s, there have been conscious and continuous improvements toward safety efforts for not only motor vehicles, but also for passengers and also for the roads to make all of that safe for us. And there have been a few agencies that are specifically focused on this. So the National Highway Traffic Safety Administration, or NHTSA, is a federal agency whose sole purpose is to make roads and cars safer. And then there's a semi-governmental agency called the Insurance Institute for Highway Safety. Obviously, it includes the insurance companies, but as you know, that's such an important part of owning and driving a motor vehicle here in the United States. And then the U.S. Consumer Product Safety Commission is also involved in making sure things like car seats are safe and other things that are in the car. And so with these conscientious and continuous improvements in safety, we're now here where we have seen a dramatic decrease in motor vehicle crash deaths, not just for kids, right, but also for all Americans. And then certainly for kids, now we see that it is no longer the leading cause of injury death for kids. So I mentioned prior with some of those figures that we published last year, both a technical report and a policy statement, which represents the work of the American Academy of Pediatrics, and it was published in Pediatrics last year. And we talk about sort of multiple ways that we can move forward for injury prevention and harm reduction around firearms. And one of the main philosophies is that you really need to have layers of protection, right, against unauthorized firearm access, both at the individual youth level, household level, and societal level. And you can kind of think of this as like preventing a toddler, from drowning in the swimming pool. You have multiple layers of basically barriers from preventing that toddler, right, from getting into a swimming pool where the toddler doesn't know how to swim and might drown. And we really do have some levers for change when we think about, how can we start to reverse this horrifying trend? So we have human factors when we think about communication and cultural change. I mean, 10, 15 years ago, nobody wanted to talk about firearms. But now we do have many citizens, gun owners and non-gun owners alike, right, who want to make sure that we can keep our kids and our citizens safe. There are actually things we can do, and I'll show you in a moment, to actually make the firearm hopefully safer so that a 2-year-old can't unintentionally shoot it themselves or, anyone else. And there are regulations, just like we have regulations around motor vehicles, we potentially could have regulations around firearms. And we do many at the state level. We have a few at the federal level. And then when you talk about the overall environment, we could talk about the built environment and the social environment, which really has to do with legislation as well. And we know that thinking about these two areas is really been an important part of injury prevention in general, and will also apply to firearm injury prevention. So what are some human factors? So for those of you who, this might date me a bit, from the 1970s. I mean, I remember my dad driving and my parents driving and nobody wore a seatbelt. And actually, like, even the children, they weren't in car seats, they weren't in seatbelts. And we basically would bump around from the front seat to the middle seat to the back seat. And now certainly, we don't do that. We know that the safest way to travel in a motor vehicle is to have a seatbelt if you are the appropriate size, or be in a car seat or a booster seat if you are a child. And so we also can now communicate around safer storage. So this is one graphic made from T4CIP, from a group at Nationwide Children's and their injury center, and just showing that, we can practice safer storage by having our firearm unloaded and having it stored separately from ammunition, and both of those things being locked away. So really communicating that, to families is important. And also cultural change. As I said, 10, 15 years ago, we really couldn't talk openly about firearms in the United States. And now, obviously, it still can be a contentious issue, but there are more and more people who are willing to stand up, for what they believe. And again, with the focus on safety. And there are things we can do for product design. So for motor vehicles, we now have airbags that can really prevented serious injuries from even low to moderate speed front end crashes. And then here's a child in a car seat. And we know that these things have saved millions of lives, prevented many deaths, as well as life-altering injuries. And believe it or not, we could do changes to the product design of firearms. So this is an example of a personalized firearm. There's a few that are starting to be available on the market. And basically, it reads your fingerprint in this example so that only the authorized user, right, can fire the firearm. These are, still being tested, and it's not clear to me exactly how reliable they are. But imagine if we can think of some engineering solutions, again, basically so that a 2-year-old, right, should not be able to fire a firearm and injure and kill anybody. There are things we can do. And then regulations. So, here are some example of toys that the Consumer Product Safety Commission has lots of regulations. So again, as we're thinking about the holidays, this car is regulated to make sure there's no lead paint. The teddy bears are regulated to make sure that the eyes don't pop off and become a choking hazard, or that the ribbons don't pop off, or that nothing, the stuffing and the fur are non-toxic. We have no regulations on safety around firearms. And as a matter of fact, there is a law preventing the Consumer Product Safety Commission from having any safety regulations on firearms, as well as firearm manufacturers are protected from liability. So actually people can't sue them if something happens, any injuries or death happen from a firearm. Some of you might be thinking, well, wait, I heard something about those Sandy Hook families. Well, the Sandy Hook families, they settled with Remington, which was a company that made the military-style weapon, which killed the children in the Sandy Hook Elementary School. And what the lawsuit was about was around marketing. It was not actually about the injuries themselves, and Remington ended up settling, which is important. But again, just goes to show you can't actually hold the firearm manufacturer liable for any actions from the firearms. And again, an example of motor vehicles, there's all these agencies focused on safety, nothing for firearms. In the social environment, we have a lot of legislation at the state level and some at the federal level that really have helped keep both the cars and roads safer. And that's why we've seen a dramatic decrease in motor vehicle crash deaths and injuries over time. This next picture is a picture of Dr. Roy Guerrero. He is the only pediatrician in Uvalde, Texas, where the Robb Elementary School shooting occurred a year ago. And this is him speaking at a celebration for the Bipartisan Safer Communities Act, which was the first federal legislation passed around firearm injury prevention in over 2 decades in the United States. And I'll talk a little bit more about that in a moment. The gentleman in the bright blue suit you may recognize as President Biden. And on the other side of Dr. Guerrero is Vice President Kamala Harris. And again, just needing to point out, and in that one story, it was actually a 2-year-old, right, who was able to pull the trigger, but just educating our families and our gun owners that gun safety in children is really something we need to be thoughtful and conscientious about, and that children as young as 3 or maybe even 2, right, can be strong enough to pull the trigger on a handgun. And so it's important for families to know that because there's some interesting parental perceptions that studies have shown over time. And so these are some older studies, but I think still relevant. And there you really aren't any newer studies today that have examined this. But this one study was a survey where they asked parents, both gun owners and non-gun owners, if they trusted their child who was 4 to 12 years old with a loaded gun. And what you'll see is that, the black bar represents parents who keep at least one firearm loaded at home, and 35% of them actually trusted their child with the loaded gun. It was lower for families that either were gun-owning parents that didn't keep a firearm loaded at home, 23%, and then non-gun owning parents, interestingly enough, still some of them trusted their child with a loaded gun, but the fewest of them did at 14%. And then in a different study, they ask parents if they believe their child would act responsibly or if they found a firearm. And the definition of responsibly was, basically from safety teaching that the NRA put forth, which is teaching the children, if you see a gun, leave the area, don't touch it, and tell a family, right? Tell an adult. And parents of both 5 to 9-year-olds and 10 to 14-year-olds, the vast majority of them felt their child would act responsibly. So, I have a son who is now in college, thank goodness, but I would not have trusted him with a firearm, even if I had given him a lot of safety training, just knowing that he would just be curious, and he absolutely would have touched it, and he definitely probably would not have told me. So, I think it's important for parents just to know the reality and understand the developmental level of their child. This doesn't mean every child will, right? But you would know your own child and what they might want to be, what they do. And that's also important to sort of think about firearms in the context of suicide. And so here's another time where I'm going to give you a moment to sort of, think to yourself, what percentage of firearm suicide versus poisoning suicide attempts are fatal? So again, if you're thinking about, what is the likelihood if you try to kill yourself by suicide that you would die versus if you try to kill yourself by poisoning? And so the numbers at the bottom tell you the percentage of people who try to kill themselves by that method. But with firearms, about 90% of the time, the individual will die if they try to use a firearm to commit suicide. However, with poisonings, we're actually very good about treating people who have tried to poison themselves in a suicide attempt. But also with poisonings, you have time. You have time for regret. You have time to have symptoms. You have time to text somebody or call somebody, or time to be ill and be taken to the hospital. But that generally doesn't happen with firearms. And so this is really why talking about means matter and the availability of firearms. And again, it's just important to think about, if we think we are, storing the firearms in a responsible way, is that going to be protective enough for our children? So this is some data that our group looked at from the National Violent Death Reporting System, and it includes actually police report data, and they interview families, so they get a lot more detailed information. And on the left-hand side, you'll see 10 to 14-year-olds broken down by suicide and unintentional shootings, and on the right-hand side, 15 to 19-year-olds, and again, broken down by suicide and unintentional shootings. And the red areas represent firearms that are either unloaded and unlocked or loaded and unlocked. So again, storing your firearm loaded and unlocked is considered the least safe or most dangerous way to store your firearm. And you'll see that, in the majority of suicides and unintentional shootings, that's how the firearm was stored when the child was able to access it. But I think what is maybe even more concerning in this story is that, even among firearms that were unloaded and locked, right, that 10 to 14-year-olds and 15 to 19-year-olds were able to find the ammunition, find the firearm, put them together, and kill themselves, or unintentionally shoot somebody. So even though we say that's a safer way, that certainly is not 100% guaranteed. If you store your firearm unloaded and with the ammunition and the firearm locked away separately, that it's not a guarantee that your child won't find it and use it. And so people have looked specifically at, does how you store the firearm matter? And one study found that each element of safe storage was associated with lower rates of adolescent suicide, as well as unintentional injuries and fatalities. And this is an older study, but you can see from the data I just showed you that's more recently from the National Violent Death Reporting System that why this would be true. And again, we define safe storage as storing the firearm unloaded, the firearm and ammunition separated and locked away separately. And so each element was associated, even if you did one or the other, but certainly if you did all of them, with decreased rates of suicide and unintentional injuries and fatalities. And what we do know, other studies have shown that, if you do counseling and safety device provision, so it's great if you counsel families, if you're a clinician, but actually providing a gun lockbox or a trigger lock, that is effective because the studies have shown that families are more likely actually to use those things and then store their firearm away. And one study found that pediatricians recommended storage to parents of 2 to 11-year-olds, that there was a 21% increase in the use of gun locks compared to controls. And so a lot of it has to do with how do you contextualize this conversation, which can be awkward, right? And so I usually tell people, well, don't start with the firearm, right? Start with things that are a little bit more innocuous, like medications. So if you have young children, or if young children are coming to visit you in the home, which is definitely something to think about, right, during the holidays, you want to make sure you lock away your medications, lock away your furniture polish, lock away laundry detergent packets, or even laundry detergent. Literally, I was working in the emergency department the other day, and some 17-month-old drank the laundry detergent and had to be observed for a while. And then, you talk about all those things and then say, just like we're talking about safety for these things, we also recommend that you lock away your firearm for safety as well. And again, thanks to T4CIP for this graphic. And then this is the graphic that I also showed you earlier, and just, kind of breaks it down for families that they need to store their firearms unloaded separately from their ammunition and locked up away and out of sight. Another thing that we encourage families to talk about is this sort of ask campaign, or asking saves kids. So you may or may not have firearms in your home, but certainly other people where your children spend time, grandparents, uncles, best friend, may have firearms as well. And so we recommend talking to families, wherever your child is going, again, in the context of safety, right? So you can maybe talk about food allergies. If you have a young child, making sure there's enough car seats. If they're going to go bicycle riding, make sure there's enough bicycle helmets. And then here, I like this example of the mom who sort of honestly throws her kid under the bus, but the mom says, I always ask families where my kids go about firearms. Do you have guns in the home? And the other parent says, yes, we do. And then the mom says, great, Jimmy is so curious and always getting into things. How are your firearms stored, right? And really saying, it's my child who might get into trouble here because he's curious. And so the other parent says, we put the gun in a safe and lock up the ammo separately. See you at 3. Now, this is a conversation that seems like it went pretty well. But I think, you can't always be sure that that's going to happen. So what I tell families and clinicians is, you have to think about what's your answer going to be if it doesn't go so well. So if the family says, no, we like to, we are worried about our safety, so we have a loaded firearm, in our bedroom. So you just have to think about what are your options. So maybe you don't go there. Maybe you offer to have the play date at your house, or maybe you just say, again, my child is so curious. Would you mind storing it not in that way while my child is at your house? Or maybe you have to cancel. So again, I don't know what the right answer is, but I think it's good to have that answer before you have that conversation. And here's some options for how firearms could be stored. So again, particularly if you're worried about an individual in the home who might be suicidal or homicidal, you can actually store your firearm outside the home. And often shooting ranges, sometimes gun stores will actually will store away your firearm, or you could store it at somebody else's home. But again, that actually then confers the risk over to someone else's house. You can buy cable or trigger locks. These are generally cheaper, especially the cable locks, although the cable locks are a little bit more prone to breaking. So probably a trigger lock is a little bit more reliable. And in addition, the ones with the keys, you can get the biometric one. So again, if you need to access your firearm quickly, this might be a good option. So you can access it with your finger, or usually more than one authorized person, can unlock the trigger lock with a biometric fingerprint and then be able to access the trigger for the firearm. Lock boxes similarly come with keypads, combinations, or biometrics, again, oftentimes with multiple fingerprints, and you can get very rapid access to your firearm that way. Gun safes, if you have more than one firearm, and again, now you see the prices are going up. Personalized smart guns, I discussed, again, allow only the authorized user to fire the firearm. I need to change this slide. There now are some in the United States. And then transfer possession, again, you could transfer it to a family member, friend, law enforcement, or to a gun range. And then extreme risk protective orders are a different way to get firearms out of the home, and I'll talk about that in a moment. Just want to point out some education about how, if you are a clinician, about how to talk to families. This is from the American Academy of Pediatrics, but you don't have to be a member necessarily in, this is free education. And then now I'm going to end by talking about advocacy related to pediatric firearm injury prevention. So in the AAP policy statement, we mentioned that's important to educate clinicians and injury prevention specialists. So that's what I'm doing here today. You need to support hospital violence intervention programs, as well as community violence intervention programs, and provide resources for violence intervention programs. And this also, community intervention programs include things like greening of neighborhood spaces. And this kind of goes to improving the social environment, right? Or rather the physical environment. And studies have shown that by cleaning up abandoned lots and greening up spaces, that there are improvements to kind of the general environment, social environment, and has also been associated with decreased community level violence. I've talked a lot about, regulating firearms as a consumer product like motor vehicles. So, that's something we can do, and then legislation. And so in some states, like my home state of Massachusetts and in California, there are over 100 gun laws. And probably not all of them are as equally effective. And this is an older cartoon, but I think it really does hone down the point. Which gun laws should we consider? So banning weapons of war, like semi-automatic military-style weapons that allow a shooter to shoot multiple rounds without reloading, stopping the flow of guns, and that's specifically around gun trafficking, keeping guns away from kids. And there's a couple of ways we can do that, including child access protection laws that hold gun owners liable if a child could theoretically access a gun, or if they do actually access a gun. Strengthening background checks, and that is supported by over 97% of United States residents. Because again, nobody wants, a person who is unsafe to themselves or others to have access to a firearm. And then treating guns like we treat cars, again, with regulations and registration. So I wanted to talk a moment about the Bipartisan Safer Communities Act. This was, again, the first federal legislation. So a lot of states have passed legislation, but first federal legislation in over 20 years. The impetus for passing this, unfortunately, was the killing of the children at the Robb Elementary School. But what it did do is expand it in a limited way, background checks for youth 18 to 21 years old who wanted to buy military-style weapons. It closed what we call the boyfriend loophole. So there is actually a federal law that says that someone who has been convicted of a domestic violence offense cannot possess or purchase a firearm, but that didn't include unmarried partners. And so this kind of closes that loophole so that any sort of domestic romantic partner could be covered under this. And then the gavel there is for extreme risk protection orders, which I'll talk about in a moment. The traffic sign is that there were some laws there to strengthen gun trafficking. And then gun shows traditionally were not subject to background checks when guns were sold there, but this now covered gun shows to also require background checks if guns were being sold there. And then there was a lot of resources put into mental health, but I just want to be very clear that people with mental health disorders are much more likely to be victims and not perpetrators of firearm violence. So this is a map of extreme risk protection order laws. So these are laws that basically allow courts to rapidly prohibit a person who is at risk for harming themselves or somebody else from purchasing or possessing a firearm. And it's for a temporary period of time, depending on the state, usually 6 months to a year. And now sometimes clinicians, as well as family members and law enforcement, can petition the court. So that's what the different colors are. And starting next year, 21 states, actually be 23 states, and the District of Columbia will have these laws. So you'll see a couple of Midwest states in there. But these laws actually have bipartisan support, so something to think about, advocating for in your state. And research has estimated that one life is saved for every 10 to 20 risk warrants issued for suicide. And there's some early data out of California showing that these laws may actually also be preventing some mass shootings. So now what should we do? Well, I want to end this talk by saying, we can all advocate. It's important for us to vote. It's important to make sure everybody has the right to vote. And you should also call and email your congressperson, either in the federal, the Senate and the House of Representatives, or at the state level, depending on the kind of legislation that you want to support. And I work very briefly for a senator's office, and I can tell you they catalog all the calls and all the emails. And at least in our office, every week they'd say, this number of people called about Medicaid, this number of people called about Medicare. So there is somebody on the other line who is looking to see what issues are important to the constituents. So if this is an important area for you, I would encourage you to reach out to your legislator at the state and federal level. So what policies do we recommend? So I didn't really talk about research funding, but we certainly need to increase research funding. We need to advocate for firearm secure storage laws to encourage families and households to store their firearms securely so that young children or others who are at risk for harming themselves or others don't have access to firearms. Universal background checks, again, to make sure those who are at risk of harming themselves or others don't have access. Extreme risk protection order laws, and repealing PLCA. So that's the law that basically says that you cannot hold a firearm manufacturer liable for any damage done by firearms, and then regulating firearms for safety like we do motor vehicles. Here are some layperson groups that you can join if you are interested in doing advocacy. I actually belong to my own chapter of Moms Demand Action in Massachusetts, and but they're Everytown for Gun Safety, June 11th, March for Our Lives, June 4th, March 4th. So many organizations out there, and Moms Demand, at least, you come when you can, you do what you can, and they're not taking roll, and they're not saying, oh, you've been absent this many times. But if you're able to do phone banking to encourage people to vote, or to go to the state house to advocate for legislation, they're there to give you those opportunities. And so, again, now we're focused here in this graph on firearms, and you'll see that dark blue line with that uptick of the increase of firearm injuries and deaths. And this is specifically about deaths, but we know the injuries are increasing as well among U.S. youth. And the truth is, I'm focused on kids and youth because I'm a pediatric emergency medicine physician, but it's increasing for all in the United States. So we're here now, and I want you to think about, all the things that we have done in the last few decades to decrease motor vehicle crash injuries. And again, I realize firearms are different. We're not going to be able to apply all the same principles, but we can apply some of those principles. And, if we don't make a concerted effort, we don't know where we're going to be 10 years from now. So the take-home points for my talk today are that firearms are the leading cause of death in U.S. youth, and not, again, just injury death, all death. And firearms are an important health disparity problem, both when you consider race, ethnicity, socioeconomic status. But hopefully I also showed you that a multi-pronged scientific approach, like what is used for motor vehicles, can be applied for firearm injury prevention. So I thank MIPA for inviting me today to close out your conference, which I understand has been a huge success. I thank you for your interest and engagement. And now I'm open for any questions.
Wonderful. Thank you so much, Dr. Lee, for that excellent talk. Really appreciate it. There are some questions in the chat, so I am just going to scroll back here. And again, folks, we have until 3:15 if we need it, so please keep those questions coming if you have them. So the first question comes from Camilla, and the question is, can the firearm manufacturers be held liable in court for the costs to the healthcare system caused from firearm injuries? Could this be similar to how the tobacco industry was held liable?
I think that's a really good point, and there are some people who are starting to look at that aspect of it. So I'm not a lawyer, so I don't actually know the legal aspects of it, but that is definitely, there are people wondering, can we use the same tactics, right, that we're used against tobacco industry? And that's why I think looking at history is important. You know, my own father smoked a pipe in the 70s. And, you know, that's because everybody did it in the 60s, and nobody, right? Nobody would have really thought that you could go against big nicotine. But then and also, right, they put a lot of false sort of data out there saying that it wasn't harmful. But then as we had really good science, we were able to use that evidence to show that no, this is actually harmful and has huge cost to the American public. And then there was a concerted effort, and that's what it has to be. It has to be intentional. And with anything with advocacy, you have to understand it's going to take time, and you need stakeholders from all different areas. So I love that question, and I think there are people starting to work in that space. I think it will be really interesting to see what's going on in the future.
Great, thank you. Another question related to some of the data that was presented earlier. I believe it was from the National Violent Death Reporting System. I'm just wondering if there are more updated numbers reflecting some of that information.
Yeah, we have not looked at that recently, but it's definitely something that we should update. And that's a really wonderful resource for researchers, but also, you know, just people who want to have data. It is publicly, a lot of it is publicly available. Some of it you do actually have to petition the CDC for as well. And so we're actually embarking on a new study looking at intimate partner violence and pregnant women and using the NBDRS. And again, it has a lot of really rich data because it kind of gets the police narratives. They interview other people to really get the circumstances, and they have all this information about the individual who was harmed, so it's only deaths, and it's violent deaths. So it's not just firearms, it's kind of any sort of intentional violent death. And then also about the perpetrator, a lot about the circumstances. So a lot of really rich data there.
I want to point out that Lori put a link in the chat to besmartforkids.org and just noted that this is an organization that is in communities across the US that offers good messaging and language. So thank you for that, Lori. We have a question for Pam. She asked if you could revisit the firearm death by intent slide, looking at the 79% increase in homicide, 95% increase in suicide. Just maybe trying to explain that a little bit more for those who maybe are not epidemiologists, and speaking about that just a little bit more.
Should I pull up the slide, do you think?
I think maybe that would be helpful.
Yeah, okay.
If you are able.
No problem. Yes.
Thank you.
Sorry, this might make everybody a bit dizzy. All the way to the beginning. But I'm glad you were interested to learn more about that. Okay, almost there. No, there we go. Okay, here. So again, we're looking at, and this is just death rates of 1 to 24-year-olds in the United States over time. So we're looking from 2001 to 2021, which again is the most recent data we have available. And I will point that out because we are in almost December of 2023, and the most recent data we have for the leading cause of death for kids is 2021, right? So we're 2 years behind. So that's a big issue too, right? So for the leading cause of death, we literally don't know what happened last year, much less what happened 2 years ago. At least that's not that's publicly available. And so what this graph shows, the dark blue line is the fatality rates due to homicide. And that increase where I'm showing with the thick blue arrow is from the nadir. So from the lowest point, which looks like was probably 2014, right? We have seen that significant increase in firearm homicides. Similarly, we have seen an increase in firearm suicides, but that's an even greater increase. So again, the actual numbers of suicides is lower than homicides, but the increase is greater. And again, looking here at the slide, it looks like the nadir, or the lowest part, the lowest rate for firearm suicide was probably 2007. So when you're comparing 2007 to 2021, there's been nearly a 100% increase. And I really kind of feel like this has sort of crept up on us. In 2017, we published a study that looked at firearms, but also looked at motor vehicles and opioids. Just we were looking at all of the increases of all the different mechanisms causing increased death in the United States, and we're just starting to see that uptick. And I think it kind of crept up on us, and it's only since we've been looking at this more and more, we realized, boy, we're seeing a big increase. And I do think COVID had made it kind of jump up some more.
Great. Thanks so much for that explanation. Really appreciate it. Another question from Valerie. You mentioned that people with mental health disorders are more likely to be victims rather than perpetrators with firearms. Can you share a bit more behind this? A lot of laws are focused on not allowing anyone with a history of mental health disorders to purchase a gun or get a concealed weapon permit.
Right. So again, that's the extreme risk protection orders and others. If you do know somebody's at risk for harming themselves or someone else, that they are prohibited from both purchasing and possessing a firearm. So that is important. I think many times what we hear in the news is that mostly for homicides, right, and mass shootings, there's always some concern, and often there is, right, there is actually some mental health background, but not always. And so a lot of those rules or those laws are actually trying to prevent suicide. And that's why I like to go back to the map with the states that show where, among the firearm deaths, are suicides higher versus homicides, because again, that is really going to kind of inform what interventions you might want to do at the state level. So yes, we do have these laws that are focused on people with a history of mental health, mental illness, but a lot of it's actually for suicide prevention. And yes, it will influence sort of homicide and mass shootings, but again, it's not to target people with mental health. It's really to try to, kind of protect them as well as protect the public.
Great, thank you. Looks like we have just a note from Kelly from Wisconsin related to a couple of pieces of legislation, one related to background checks, one related to ERPO, one a safe storage tax incentive currently at the state level, with the Senate bill and Assembly bill numbers in the chat as well. And Kelly provided her email if there is additional information needed on that. So thanks, Kelly. I'm just going to pause. I don't see any other questions in the chat, and see if anybody has anything. Again, of course, you can message Dr. Lee after today's presentation if something comes up for you. And I will keep an eye on the chat as we close out today. But I would just like to thank you so much, Dr. Lee. I'm not seeing anything else in the chat related to questions for this really informative presentation. And I am going to kick it over to Morgan to close us out today.
Yeah, it's been such a pleasure to host this year's conference. Thank you all for coming. We just have some quick announcements. There will be a survey going around that will be emailed to you guys, and we appreciate it if you would take a few moments to complete it, and we'll use that for planning for the 2024 conference. As noted, kind of throughout the conference, all videos and resources will be available on the MIPA website. And if you haven't already, we do encourage you to sign up to become a member. And you can do that at www.midwestinjurypreventionalliance.org. And if you have any questions about that, you can also contact info@midwestinjurypreventionalliance.org. But the big reveal of today is that the 2024 summit will be hosted by Wisconsin. So we are so excited to have them host again. And we look forward to seeing you guys next year. But with that being said, I think I do see one more question, and so I will kick it back to Sarah with some more closing remarks.
Yeah, absolutely. The question is more for just related to CEUs. Are there MCHES certificates for CEUs? We'll get that information to you, Dr. DeCarli. And then I just want to note that Laura put our evaluation for today's conference in the chat as well. So encourage folks to do that. Just as we finish up this afternoon, I want to remind folks that, as we noted earlier this morning, MIPA, the Midwest Injury Prevention Alliance, is an organization of injury professionals. And our goal is to work collaboratively to reduce unintentional and intentional injury related death and disability. We facilitate development of a coordinated approach for unintentional and intentional injury prevention and control in our region. We also develop and share injury prevention planning, education, evaluation and policy strategies, training, research, and other initiatives among members of our MIPA network. We foster collaboration and communication, and there is another link in the chat. If you are not currently a member, please join us at no cost via that link. We would love to have you be part of our group. And that is what we have for you today. Thank you again for joining. Thanks to our organizers. Thanks to Morgan and folks from Indiana for hosting us this year. Thanks to all of you for attending and engaging with us today. Thank you all for what you all are doing to make a difference for those we serve across our states. We look forward to seeing you next year and hope to see many of you who aren't already members join the MIPA efforts. Thanks so much, everyone. Have a great and safe day. Thank you.
Thank you all.